Anybody know? This is a non-rebreather, okay? There's usually two pieces to it, so you have to reconnect it in order to use it. All right? To connect this system, we have to pull this rubber tube off so that, because when the gas comes through, it goes through the machine, through this rubber tube, and then you're going to insert it here. This is a nice snug fit. Kind of have to twist it in there a little bit. All right, and then just to keep it secure, then you're going to put some porous tape around it just to keep it nice and tight.
I'm sorry, what is the black tube called that it connects to? Yes.
This is black anesthetic tube, so this is what's carrying your oxygen and your anesthesia to your patient. Okay. So if it is a rebreathing system, it's hooked up to the machine. Because this is non-rebreathing, it's hooking right up to the tubing here.
Okay, thank you.
Okay, yep. So we're going to put a piece of tape here to secure it. And then with this, you are going to use this for 10 pounds or under with a 1 liter bag. Okay. You are also going to use a small humid vent. All right. This blue part here connects back on the evacuation system. So this one you're going to take off for this unit. And you're going to connect to the evacuation. And now you are set to use this on your patient. Okay? So the way that this one works is when the animal breathes in, they take the anesthetic and the oxygen through this plastic tube here. They breathe it in. When they exhale, it comes out and goes down through this tube. This wastes a lot more gas because we are not recycling and reusing any of it through our system. However, the benefit is when they're trying to push it through this machine and they're so little, they can't do it very well, and therefore they end up getting dead airspace and they end up rebreathing stuff that has already been exhaled and everything like that. So it's a lot safer for our smaller patients that don't have near the lung capacity. All right. It's very common that this bag will stay flat. All right. It's not real common that it will blow up like the bags on here will, so that is completely normal. If you need to close the pop-off, like we will every 5 minutes to breathe for our patient, right here is the pop-off valve on it. We're going to pull it to the side, let it fill a little bit to give our patient appropriate breaths, and we'll talk about that a little bit more later. And then never forget to open the pop-off valve. What happens if I forget to open the pop-off valve?
You suffocate.
You don't suffocate. Their lungs explode, literally can rupture. Okay? Because what happens is when you close this, oh, it was closed. I just realized that. Close is this way. When you close this, it closes off the ability for any gas to escape through the blue tube, and it just continues to fill and fill and fill and fill and fill. So as this bag continues to grow and grow and grow and put pressure here, it's also putting that same amount of pressure on the lungs, and you can rupture lungs. Okay? That would be contraindicated. Just saying. Or they die. Right. Big problems. Yes. Okay? So whenever you're using the pop-off valve, I always say do not, if you close it, don't take your hand off of it until you open it. And that is the safest way to guarantee that you've opened it. The other thing I do is after I've opened it, I always squeeze my bag to make sure it is open and flowing again. Okay? Okay, so this is for 10 pounds and under.
So for that one, you would use the pop-off valve on the machine?
Right, because it's not flowing through the machine. So the only thing that this patient is in contact with in this machine is the oxygen here that comes up through this tube into the anesthetic vaporizer and then into the patient. It doesn't go all through this part of the system. Okay, this is completely bypassed. So the top portion is completely bypassed here.
So you don't rely on the manometer up there?
Right. Yeah, when you're giving breaths, it's all by feel. We can't use this manometer up here to see how much pressure we're using. It's all by feel. So it takes a little bit to get used to it. All right, so I'm going to disconnect this back again. I'm going to reconnect this here. Does anybody have any questions about this before I fully disconnect?
Which one are we going to use first? Are we going to use the breathing system?
It all depends on your patient size. So So if you have a cat, you're going to be using this first. If you have a dog that is over 10 pounds, or it depends on the cat too. But one thing I want you guys to keep in mind as well is the system that we set up for them is the system we set up for their ideal body weight. So if you have a 5 out of 5 sausage walking in your door, are you going to grade him at his 22 pounds, or are you going to grade him at what he should be at his 15 pounds? Right. Okay? Because his lungs don't grow in size just because his fat cells do. Okay?
Wouldn't it be nice if we just grew to accommodate